Every single year, approximately 1/3 of people over 65 years old fall. 20% of those land in the emergency department, with more and more people dying. These numbers will keep increasing now that the baby boomers are coming of age. But many falls can be prevented with adequate screening measures, and physical therapists are the ones to do this. Hi and welcome back to Physiotutors. This clinical guidance statement combined the recommendations of 3 practice guidelines to provide clear statements for practice. In this video, you will learn how to properly screen and assess for falls and how to manage them. The first question is, when should you screen? Simply ask the person in front of you if he or she has fallen in the previous 12 months. You should do this every once in a while. If not, ask if he or she experiences mobility or walking problems. If at least one of 2 is positive, you should screen this quickly. Again, ask these questions routinely. Things change. Sometimes you can already observe balance or mobility impairments when they walk into the clinic. If so, assess them, regardless of their falling history and their self-reported functioning. Are there no balance or walking impairments and no history of falls in the previous 12 months, then you can leave them be. Carry on treating them for whatever they came in for. Now, what do we mean by this balance and mobility screening? It's no boatload of tests because we're unsure if there are any impairments at all. Simply watch them walk, transfer in and out of a chair, turn, or ask them to do a specific task where they feel uncertain if they reported any. See if you can find something that requires further assessment. For the sake of this video, of course, we'll dive into the assessment. We start off with medication review. Is your patient taking multiple and possibly unnecessary meds? Are there any psychoactive drugs taken? And if so, you can report this back to the GP in light of the risk of falling. The second aspect to get into is the medical history. You are looking for potentially unmanaged risk factors like osteoporosis, depression, urinary incontinence, cardiac diseases, etc. Now that the more medical stuff is out of the way, we can get into body function and structure, participation and activities, and environmental and personal factors that might contribute. The following items are all risk factors. Every positive one should be addressed if it is in the scope of the physical therapist. First off is strength. It should come as no surprise that muscular weakness is an established risk factor for falls. So measure the strength and take note of any weaknesses. The second one is balance. The guidelines provide no specific tools to screen for balance, so here are a few suggestions from us. Next up, gait. There are numerous tests and checklists to assess gait. The guidelines recommend that the provider should determine the appropriate measures. Again, here are some ideas from us. Now that we covered strength, balance, and gait, we can get into the activities of daily living. What does a typical day for your patient look like? Do they use any walking aids with certain activities? One CPG recommended asking about daily physical activity since moderate to high physical activity is protective against falls. They can be strong and have great balance, but loose shoes and carpets all over their home will still heighten the risk of falls. Make sure to check footwear and have a walk through their home if you're able to. All 3 practice guidelines advise screening cognition and neurological function. There are, however, discussions on how and what. Peripheral neuromuscular function should be tested, including nerve function, reflexes, and proprioception. Furthermore, cerebellar, extrapyramidal, and cortical functions can be assessed. We suggest adding a mini-mental state exam for cognition. Testing for cardiac function should be incorporated into your assessment as well. You might think that this should be done by a cardiac professional, but a physical therapist could easily measure things like heart rate and rhythm, postural pulse, blood pressure, and postural hypotension to see if there are any issues there. Assessing vision is up for discussion. One practice guideline recommends screening for different visual functions, but the others don't. Maybe refer to a specialist for this. Lastly, urinary incontinence. All 3 guidelines recommend assessing this. You could specifically ask about urge or stress incontinence. That's quite a list of risk factors. As a side note, 3 more personal factors were suggested to screen, but there was no agreement there. These are fear and health perception, social support, and alcohol use. Now that we covered the assessment part, you might ask yourself, what does this all mean and what should I do about it? It's actually pretty straightforward. Every positive risk factor should be addressed in treatment as long as it is within the scope of your practice. There are a few things you must do. You must provide individually prescribed strength and balance training. Adding to this, gait training should be incorporated as well. If you found any home hazards such as carpets or door thresholds, address these as with inappropriate footwear. For a general overview of the discussed items, pause the video here. That's it for this video. I hope you learned something today. I am Max for Physiotutors and I will see you in another video. Bye.